Welcome back to the deep dive. Today, we are jumping straight into a subject that's, well, it's often literally kept under wraps.
That's a good way to put it.
While facial breakouts get all the attention, acne on the back, what we all call Bacne, is incredibly common.
It really is.
Yeah.
We're talking about something that affects about half of all people who deal with body acne. And it is notoriously stubborn.
Right.
And that's because Bacne isn't just, a few random pimples. It's a genuine skin disorder.
Skin disorder, okay.
Yeah, and it's all driven by a pretty fundamental mechanism.
Mm-hmm.
Your hair follicles get clogged up.
By what exactly?
It's a mix, the combination of bacteria, excess oil, and dead skin cells. These clogs lead to inflammation, and then you get that whole spectrum of issues from, mild whiteheads to really deep, painful cysts.
So our mission today is to give you the shortcut to understanding this. We need to figure out why the back, specifically, is such a breakout hotspot, and then detail the exact types of lesions you might be seeing, because recognizing the symptom actually changes the treatment plan.
It absolutely does. And then we can provide a totally actionable plan based on the sources we've looked at.
And we found some pretty surprising things.
We really did. Some highly surprising information you can act on immediately, including some specific dietary culprits and a crucial, really counterintuitive change you might need to make to your daily shower routine.
A shower habit that could be making it worse.
It could be, yeah.
Okay, let's unpack this. We have to start with that foundational question. Why the back? Is it just because it's a large area?
It's a combination of area and density. The back is just incredibly rich in sebaceous glands.
The oil factories.
Exactly. You can think of them as these tiny oil factories. So when these glands overproduce sebum, that oily substance, it mixes with shed dead skin cells.
And that forms a plug.
It forms a plug that blocks the hair follicle. And that blocked pore, which is now trapped and starved of oxygen, becomes the perfect breeding ground for a specific bacteria, Propionibacterium acnes, to just grow.
And that's when your immune system notices this bacteria party, rushes in, and bam, inflammation.
That's it. That's the redness and swelling we see. But it's so crucial for you to look at your back or, have someone else look and understand precisely which type of lesion you're dealing with.
Because severity dictates urgency.
Precisely. We've identified 7 distinct symptoms.
All right, let's define that landscape. Let's move from the sort of non-inflammatory types to the really painful ones.
Okay, so starting with the non-inflammatory types, we have blackheads. Most people know these. They're called open comedones.
Open, meaning the pore is open to the air.
Exactly. The pore is open, which allows that oily mixture inside to oxidize when it hits the air. That's what gives it that dark, almost black appearance. They're usually pretty easy to manage.
Which are different from whiteheads or closed comedones?
Correct. With whiteheads, the pore top has sealed over the clog, so you see these tiny flesh-colored bumps.
No oxidation.
Right. But because they're closed, it's often much harder for topical treatments to get in there, which makes them a bit more stubborn than blackheads.
Okay, so now we're crossing the line into the inflammatory lesions, the ones that hurt.
First up are papules. These are your small, elevated red pimples. They signal moderate inflammation, and they're definitely painful to the touch.
And if that gets worse?
If the inflammation worsens, they can become pustules. These are larger, they're visibly filled with pus, and more painful. This stage means you're dealing with moderate to severe acne.
Okay, and then we get into the heavy hitters, the ones that are basically screaming, go see a professional.
Yeah, now we're talking deep tissue infections. First, nodules. These are large, firm, painful lumps that form far beneath the skin's surface.
You can't see a head on them.
No, they often lack a visible head, and they can take weeks, sometimes even months, to go away.
Ugh.
And even worse are cysts.
Ugh.
These are excruciating, deeply rooted, pus-filled sores that are very, very susceptible to rupturing under the skin. They demand immediate medical attention.
Because the scarring risk is so high.
Extremely high. And that scarring itself, whether it's raised, pitted, or darkened, that's our 7th type of manifestation.
That's a serious range. And I think this brings us to a really key insight from our sources. The skin on your back is actually different.
It is. This is fascinating. It's a physical barrier challenge. The skin on your back is significantly thicker than the skin on your face.
Thicker, like armor.
Almost, yeah. That structural difference acts like armor, making it so much harder for over-the-counter creams and gels to penetrate deeply enough to reach the sebaceous gland where the whole problem starts.
So the stuff you use on your face might just not be strong enough to get through that barrier on your back.
That's it. And that explains why treatment is such a frustrating uphill battle for so many people.
Which leads us right into the why, the root
Let's
causes.
get into it.
So we've established what Bacne is. Now let's talk about the internal fires and external friction that cause these flare-ups. Starting inside, what are the non-negotiables?
Hormones. Hormones are the main catalyst.
Okay.
When we see surges in androgens like testosterone, this is typical during puberty, that 12 to 24 age range, it dramatically increases sebum production.
And that's why teens are so prone to it.
Exactly. It's also a key reason why research consistently suggests men are often more prone to Bacne and more severe Bacne than women, just due to higher natural testosterone levels.
But women still get it, obviously.
Oh, absolutely. Women still experience hormone-driven acne, but it's often tied to menstruation, pregnancy, or conditions like PCOS.
So if your parents had really bad acne, are you just out of luck?
You're starting behind the curve, for sure. Genetics strongly influence your skin type, your pore size, and just how oily you are naturally. It's a huge hereditary factor.
And what about medications?
That's another internal driver.
Yeah.
Certain drugs, things like steroids, lithium, or some anticonvulsants, can throw your hormone and oil production into chaos.
Okay, now let's talk about the external stuff. The lifestyle triggers we actually have some control over. I want to dig into this term, acne mechanica.
Yes, acne mechanica. That's basically friction. Acne.
Friction.
It's a very common cause of Bacne, driven by pressure and rubbing that irritates the skin and, crucially, traps sweat and bacteria.
So like a tight sports bra or a heavy backpack.
Exactly. Compression shirts, bulky backpacks, even something like a guitar strap worn for hours. All of that causes friction.
This is that classic gym bag syndrome. You finish a sweaty workout, but you leave that damp, bacteria-filled shirt on for another hour while you run errands.
That is the absolute perfect storm. That combination of trapped heat, sweat, dead skin cells, and bacteria is an incubation chamber for Bacne. You have to wash it off immediately.
And this is where it gets really counterintuitive, the hot shower problem. Our instinct is to just blast a breakout with scalding water.
And that instinct is probably doing more harm than good.
Ow.
Hot water is abrasive. It strips your skin of its natural moisture barrier, all its beneficial oils.
Yeah.
When your skin senses that severe dehydration, it panics. It interprets it as an attack.
And the body's response to extreme dryness is to
Overcompensate. The sebaceous glands go into immediate overdrive. They start pumping out sebum to try and replace that lost moisture, and you end up with a flood of oil that just clogs more pores. Plus, the heat itself makes your pores open wider, increasing the risk of bacteria getting in deeper. Lukewarm water is what we strongly recommend.
So for years, that instinct for a scalding hot shower has been actively triggering a rebound oil cycle. That is a huge behavioral shift. Okay, finally.
Diet.
Right. Now, diet isn't the primary cause, but for people who are already prone, it is a proven trigger for more oil.
What are we talking about?
The sources point to two main categories. First, high glycemic foods,
Sugar.
processed carbs, white bread, sugary drinks, anything that spikes your blood sugar quickly. That causes a spike in insulin, and high insulin levels tell the sebaceous glands to make more oil.
And the second culprit, which I find really surprising, is dairy. And often the low-fat versions, right?
Yeah.
Why is skim milk called out?
That's the subtlety most people miss. Dairy, and especially skim milk, has these bioactive molecules that stimulate the production of something called insulin-like growth factor, or IGF-1.
And elevated IGF-1 acts a lot like certain hormones. It interferes with the skin's natural control of oil production and tells those glands to ramp up output. It's less about the fat, more about the growth factors.
That's incredible. So it's this whole interplay of genetics, hormones, friction, diet. Okay, let's shift to the action plan.
Let's go.
Assuming we're dealing with mild to moderate Bacne, what are the steps you should take? Moving beyond just shower more.
We need a balanced approach. It's not just about cleaning, it's about treating inflammation and supporting the skin barrier without overstripping it.
Okay, let's break down those 10 key actionable steps. The first couple deal with just cleansing.
Right. 1, you have to wash your back regularly with an acne-fighting cleanser. Look for ingredients like salicylic acid or benzoyl peroxide.
Okay.
And 2, exfoliation is non-negotiable, but it has to be gentle.
So are we talking about those gritty, abrasive scrubs?
No, definitely not. Aggressive physical scrubbing can actually make inflammation worse and spread the bacteria around. We advise chemical exfoliation.
With what?
Using AHAs, like glycolic acid, or BHAs, like salicylic acid, just 2 or 3 times a week. They gently dissolve the glue holding dead skin cells to the surface.
Okay, so the next two steps address that acne mechanica problem.
Exactly. 3. Shower immediately after you sweat. Don't wait. And 4. Wear loose, breathable clothing. Cotton is great. Moisture-wicking fabrics are great. Reduce that friction and humidity.
Numbers 5 and 6 deal with products, what we're putting on our skin and even our hair.
Yes. 5. Be hyper-aware of your products. Avoid anything oily, greasy, or comedogenic. This even includes heavy hair conditioners that can run down your back when you rinse.
That's a big one.
A huge one. And 6. Moisturize. I know it sounds contradictory for oily skin, but you have to restore that skin barrier. Just make sure it's an oil-free, non-comedogenic lotion.
Okay, then we get into the behavioral and internal steps, the ones that require discipline.
7. Do not pick or pop. I can't stress this enough. Picking drives the infection deeper, which dramatically increases your chance of permanent scarring.
8 is simple.
8. Drink plenty of water. Hydration supports your skin's overall health and helps regulate that moisture barrier.
And finally, 9 and 10, the full body measures.
9. Maintain that healthy, low glycemic diet, low sugar, low dairy, and bring in anti-inflammatory foods like omega-3s, fruits and vegetables. And 10. Manage your stress.
How does stress link to Bacne?
Stress triggers cortisol release, and a surge in cortisol directly stimulates more oil production. A stress reduction plan is a Bacne reduction plan.
So if you implement all these steps and the issue persists, or if you started out with those severe lesions we talked about, what are the clinical options?
At that point, a professional is needed. They often start with higher concentration topicals. If those fail, prescription options include things like oral antibiotics to reduce bacteria and inflammation.
Or hormonal therapies.
Yes, things like specific birth control pills can help regulate oil production. Or for the most resistant scarring cystic cases, there's isotretinoin, which most people know as Accutane.
And what about in-office procedures, especially for scarring?
Because the back skin is so thick, dermatologists can use more powerful treatments. Chemical peels using high-strength glycolic or salicylic acids offer much deeper exfoliation and are great for fading scars.
And I've heard about light therapy.
Yes, laser and light therapy, especially blue light, which is specifically tuned to target and kill the P. acnes bacteria inside the follicle.
So if someone listening is experiencing those deep, painful nodules, when is the right time to stop the home remedies and just pick up the phone?
Immediately. If your acne is worsening, if it's severely painful, or if you have those deep, hard nodules or weeping cysts, you must see a doctor to prevent permanent damage.
That's serious.
Absolutely. If you're seeing significant scarring start to form, or if your acne comes with other symptoms like extreme fatigue or weight changes, a professional diagnosis is required to rule out underlying issues.
Before we wrap up, I want to spotlight 2 specific ingredients from our source material that are highly effective.
Okay.
The first one is hypochlorous acid, or HOCl.
This is a fascinating one. It's so interesting because it's naturally produced by our own immune cells to fight off germs.
So you can use it as a topical.
Yes, as a topical spray, it's a powerful antibacterial against P. acnes. It's highly anti-inflammatory, and it's gentle enough even for sensitive skin. It's a great thing to spray on right after a workout.
And the second is a classic, tea tree oil.
Stood the test of time. It's well studied for its strong antimicrobial properties. It helps control that excess sebum production, and it helps reduce the swelling and redness of those active, angry breakouts.
So the synthesis here seems pretty clear.
It is. Back acne is complex. It requires you to acknowledge the unique thickness of the skin there, understand the role of your hormones and genetics, and then meticulously manage those environmental triggers: friction, sweat, and diet.
It's a multifaceted approach.
Exactly. Success comes from being persistent with that approach.
So what does this all mean for the future? Since the primary challenge with Bacne is that thick skin preventing deep penetration, how might future innovations move beyond just surface application?
That's a great question.
Could technology like, say, tiny microneedles or specialized devices eventually target the sebaceous glands themselves, deep within the skin, instead of just relying on creams that struggle to get through that tough barrier?
That idea, targeting the oil factory deep inside the dermis rather than just fighting the inflammation on the surface, that's a thought worth mulling over.
We'll leave you there to ponder the future of skin technology.
Thank you for joining us for the deep dive into Bacne. We hope this has clarified your understanding and armed you with a real action plan for clearer skin.
Until next time, stay curious and stay well.